Imagine this. You walk out to the barn, and your horse, usually so vibrant, is standing quietly, but something's definitely off.
Yeah.
Notice their breathing is fast, shallow, almost frantic. What's happening? Today, we're taking a deep dive into one of the most critical, though thankfully rare, equine emergencies: equine pneumothorax. This deep dive is for you, our curious listener, who wants to quickly grasp what this condition is, what causes it, and how vets race against the clock to save a horse's life.
That's right. Our mission here is really to pull out the most crucial insights from some pretty specialized veterinary sources. We're aiming to give you those aha moments,
Helping you understand how a seemingly simple issue, air in the wrong place, can have such a huge and immediate impact on a horse's ability to breathe and even survive.
So what actually causes a horse's lung to collapse? And what do vets do when every single second counts? Let's unpack this. Okay, let's start with the absolute basics. When we talk about pneumothorax in horses, what exactly are we dealing with? At its core, it's pretty straightforward, actually. It's simply air where it shouldn't be inside the chest. Think of it as air getting into the space around the lungs, not in them.
Okay, around the lungs.
Yeah, that space, the pleural cavity. It's normally under a slight vacuum pressure, which is what helps the lungs expand properly. When air gets in there, well, that vacuum is lost.
And the consequence of that vacuum being gone is that the lung collapses.
Precisely. This air buildup causes the lung to collapse down. It severely impairs its ability to expand and exchange oxygen. And as you can imagine, this leads to significant respiratory distress. It's a serious condition, needing prompt diagnosis and treatment really fast.
Okay, here's where it gets really interesting for me. What causes this air to sneak into a place it absolutely shouldn't be? You might immediately think of, obvious injuries, but the sources show there's actually more to it.
You're spot on. The fundamental problem, always, is some kind of breach. Either a hole in the chest wall itself, or maybe in the lung or airway. That breach lets air escape into that pleural space. And yes, trauma is definitely the most common culprit.
Okay, trauma.
When we think trauma, penetrating thoracic wounds are often top of the list, direct injuries creating an opening. Picture a horse maybe impaling itself on a fence post.
Oof.
Yeah. Or gunshot wounds, deep cuts from falls, kicks from another horse, even sharp objects like wire or nails. Air literally gets sucked in from outside.
Right.
Then there's blunt thoracic trauma. This might not look as dramatic on the surface. Could be a really severe kick, a bad fall, trailer accidents, collisions. These forces can break ribs, and those broken ribs can then tear the lung or its lining, or sometimes the force itself can just rupture the lung, even without a rib fracture.
Yeah, and I've heard the term iatrogenic used in medicine.
Right.
That's when the medical treatment itself inadvertently causes the problem, right?
That's correct. Iatrogenic pneumothorax. It's thankfully less common in horses, but it can happen. It's an unfortunate complication of certain veterinary procedures, things like thoracentesis, that's a chest tap to drain fluid or placing a chest tube, or very rarely during an aggressive lung biopsy. It's an acknowledged risk, though vets obviously take huge precautions.
So beyond those more direct injuries or medical mishaps, what are some of the less obvious ways this might happen? Maybe even surprising ways.
Yeah, this is where it gets fascinating. Sometimes the body almost turns on itself. Take pleural pneumonia, often called ship-in fever.
Okay.
If a horse has a really severe chronic case, the infection can cause parts of the lung tissue to necrotize, basically, to die off. If one of these dead areas, or maybe a lung abscess, ruptures, it can create a direct connection. We call it a bronchopleural fistula.
A fistula.
Yeah, a connection between an airway and that pleural space. So now, every time the horse breathes in, air leaks out into the chest cavity. It's pretty rare, but complications from upper airway surgery, like a tracheostomy, can sometimes let air get into the mediastinum, the central chest space. From there, it can sometimes track into the pleural space. We also might see it with a diaphragmatic hernia if, say, abdominal organs poke through into the chest and then rupture. And finally, the really puzzling ones are the spontaneous or idiopathic cases.
Meaning no known cause.
Exactly. They just happen without any obvious reason, maybe due to a hidden weakness, like a ruptured congenital air sac they were born with. It's a real mystery when those pop up.
Now, our sources mention 3 key types of pneumothorax, and one of them sounds like an immediate, really dire emergency. So what do these different types mean for understanding how severe it is and, how quickly vets need to act?
Yeah, this distinction is absolutely critical. First, you've got closed pneumothorax. In this case, air gets into the pleural space, but the hole that let it in, whether it's in the lung or the chest wall, it seals itself off.
Ah, okay, so it stops leaking.
Right. No more air gets in, it's more stable, relatively speaking, though still very serious. Then there's open pneumothorax. This one's often more obvious from the outside. It means there's a persistent hole in the chest wall. Air moves freely in and out of the pleural space with every breath. You might hear it called a sucking chest wound.
Right, I've heard that term.
And then the one that truly demands immediate life-saving action. Tension pneumothorax.
Okay, this is the bad word.
This is the really bad one. It's a life-threatening medical emergency. Think of it like a one-way valve. Air rushes into the pleural cavity during inspiration, but it gets trapped. It cannot escape when the horse breathes out.
Oh, wow.
So this pressure builds up incredibly fast. It causes the affected lung to completely collapse. But it gets worse. The pressure actually starts pushing the heart and the other lung across to the opposite side of the chest.
Seriously, it shifts everything over.
Yes, it physically shifts the mediastinum. And this severely compresses the major blood vessels, the vena cava. This whole cascade can quickly lead to cardiovascular collapse and respiratory arrest. It's terrifying. It's a true race against time.
So if a horse is going through this, what would an owner actually see? What are those immediate red flags? And what would a vet be looking for?
Well, you definitely see dramatic signs of respiratory distress, obvious difficulty breathing. The horse would likely be breathing very rapidly and shallowly. That's tachypnea. They're trying to minimize chest expansion because it hurts.
Right.
This would likely be paired with dyspnea, which is labored breathing. You might see flared nostrils, a really pronounced effort using their abdominal muscles. Sometimes you see that heave line.
Okay.
Or even open-mouthed breathing. That's a very, very grave sign in horses.
Yeah.
In the most severe cases, because oxygen levels in the blood get critically low, you might see cyanosis, that bluish color in the gums or tongue.
Oh, wow. Bluish.
Yeah. And the horse will be visibly restless, anxious. I mean, they're struggling to get air. It's frightening for them.
Absolutely.
Then, when a vet examines the horse, listening to the chest auscultation is key. The most characteristic finding is muffled or absent lung sounds, especially up high, dorsally on the chest. If there's a lot of air, even the heart sounds might seem muffled.
Okay. So quiet where there should be noise.
Exactly. And if the vet taps on the chest, that's percussion instead of the normal resonant sound over healthy lung tissue, they might hear a hollow, almost drum-like sound. We call that tympany. It indicates air underneath.
Huh. Like tapping a drum.
Precisely. Other important visual clues can include subcutaneous emphysema.
Subcutaneous. Under the skin.
Yeah, air trapped under the skin. It feels kind of like crackling or bubble wrap if you press on it. You often see it around the neck, shoulder, or chest area, especially after trauma.
Yep.
You might also notice asymmetrical thoracic expansion. One side of the chest looks bigger or isn't moving as much as the other. The horse's heart rate will likely be high tachycardia. They'll probably show signs of pain if you touch the chest area. And if there's an underlying infection like pleural pneumonia, you might see depression. Maybe they're off their feed, maybe a fever. And of course, any obvious external wounds, bruising, or swelling are huge red flags pointing towards trauma.
It sounds like a really complex puzzle to put together, especially when things are happening fast. So what's the diagnostic journey like? How do vets confirm a collapsed lung in a horse?
It really is like rapid-fire detective work. It always starts with clinical suspicion. Based on the horse's history, was there trauma? Do they have shipping fever? And those really striking signs like the acute breathing problems, those muffled lung sounds, maybe that subcutaneous emphysema.
Okay, putting the clues together.
Exactly. Then a thorough physical exam follows quickly, really focusing on listening to and tapping on the chest. But the real game changer, especially out in the field, the first thing vets often reach for now is thoracic ultrasonography. Ultrasound.
Ah, ultrasound. Okay.
It's incredibly valuable. The key finding they're looking for is the absence of something called lung sliding. Normally, you see this kind of shimmering movement on the screen where the two layers of the pleura, the lung lining, slide past each other with each breath.
Right.
If that sliding movement is gone, if the line looks static, that's a huge clue for pneumothorax. And sometimes you can even see what's called a lung point. That's where you see sliding on one part of the screen and then suddenly no sliding right next to it, and this border moves back and forth as the horse breathes.
Oh, interesting. So it shows you right where the collapsed lung edge is.
Exactly. It's highly specific for pneumothorax. Now, while it can be challenging to do on a big adult horse, thoracic radiography x-rays are still considered the gold standard for really confirming things.
X-rays.
Okay. They let you quantify how much air is actually in there, see exactly how much the lung has collapsed, and importantly, identify underlying issues like hidden abscesses or maybe rib fractures. On the x-ray, you'd see a dark, air-filled area and the edge of the lung pulled away from the chest wall.
Clear visual evidence then.
Yes. And then there's thoracocentesis, that pleural tap we mentioned. It's often both diagnostic and therapeutic. If you stick a needle in and aspirate air, well, that confirms pneumothorax right there. And if there's fluid, you can collect it for analysis.
2 birds with 1 stone, potentially.
Exactly. Finally, blood gas analysis is important to see how severely the horse's blood oxygen levels are affected, how much trouble they're really in. And while it's rarely the primary tool, sometimes endoscopy might be used to rule out other airway issues or maybe indirectly spot signs of an internal air leak, like that fistula we talked about.
Yeah. So given how serious this is, how quickly it can get bad, what does that mean for treatment? The sources make it crystal clear. This isn't a wait-and-see situation. It's all about getting that air out fast and tackling whatever caused it in the first place.
Absolutely. It is a true medical emergency. Action has to be immediate. The very first step is always patient stabilization. Think ABCs, airway, breathing, circulation. Now, if tension pneumothorax is suspected, that absolute worst-case life-threatening scenario, the immediate, #1 priority is relieving that crushing pressure.
Right, that one-way valve thing.
Exactly. This might mean the vet makes an opening in the chest wall right away. Or, more commonly, quickly inserts a large bore needle or catheter into the upper chest cavity. Just letting that trapped air hiss out can be life-saving.
Wow.
Then, supplemental oxygen therapy is crucial for any horse struggling to breathe. Intravenous fluids are usually started to support circulation and treat shock. Pain management is also key, usually with NSAIDs like Banamine or Bute. And sometimes mild sedation might be needed just to reduce the horse's anxiety, which can make breathing even harder.
Okay, so stabilize first, then what?
Once the horse is a bit more stable, the next big goal is to remove that trapped air from the pleural space in a more controlled, ongoing way. For a significant pneumothorax, this usually involves placing a thoracostomy tube or chest tube. It's surgically placed into the pleural space.
A chest tube, okay.
This tube allows for continuous or intermittent drainage of both air and any fluid that might be accumulating. It's usually connected to a special one-way valve, like a Heimlich valve, or sometimes a 3-way stopcock system. The point is to let air out, but prevent it from getting sucked back in.
Clever.
In really severe cases, they might even hook it up to a continuous suction system. And that tube stays in place until the air leakage stops, the lung reinflates, and the vet can hear normal lung sounds again.
And what about fixing the original problem? The whole...
Absolutely vital for long-term success. You have to address the underlying cause. If it's a chest wall wound, like from that fence post, any penetrating opening must be immediately sealed with an airtight dressing. Think thick Vaseline gauze, even plastic wrap taped down tight. That stops more air getting sucked in.
Like a temporary patch.
Exactly. Then, once the horse is stable, the wound needs to be properly cleaned and surgically closed. If pleural pneumonia is the culprit, well, that means aggressive, long-term systemic antibiotics, often based on culture results from fluid samples. Significant rib fractures might need surgical stabilization. A diaphragmatic hernia, if that's the cause, will eventually need surgical repair, though usually after the pneumothorax itself is under control.
Makes sense.
And regardless of the cause, broad-spectrum antibiotics are almost always given prophylactically just to prevent or treat secondary bacterial infections, which are a big risk. And finally, strict stall rest is absolutely non-negotiable. The horse needs time to heal without exertion.
So if we connect all this back to the bigger picture, what's the actual outlook for a horse that develops pneumothorax? The sources seem to say guarded to fair, but it sounds like with all these treatments, there is definite hope.
You're right. The prognosis really can vary quite a bit. There are factors that definitely point towards a better prognosis. For instance, traumatic pneumothorax, especially if there isn't severe underlying lung disease already present. If it's caught early and managed aggressively, survival rates can actually be pretty good. Some studies report around 70% survival.
That's encouraging.
Yeah. Also, if it's only affecting one lung unilateral, that's much better than if both lungs are involved. The absence of other complications, like a lot of fluid buildup in the chest, pleural effusion, or infection, also significantly improves the odds. And as we've kind of stressed throughout, early diagnosis and really swift, appropriate intervention are absolutely crucial for success. Time matters.
Okay, so what makes the prognosis worse?
Well, several factors unfortunately point towards a poorer prognosis. Tension pneumothorax, as we discussed, is devastating if not relieved immediately. The prognosis is grave in those initial moments. Bilateral pneumothorax, where both lungs are collapsed, is extremely serious because the horse has so little functional lung left.
But double the problem.
Exactly. And when the pneumothorax is secondary to really severe pleural pneumonia or widespread lung abscesses, the prognosis tends to drop significantly. Some studies show survival rates as low as maybe 35% in those cases, simply because the underlying lung damage is so extensive and hard to treat.
That's tough.
Yeah. Developing serious complications also worsens the outlook, things like persistent low oxygen levels, ongoing infection that won't clear up, or chronic scarring and restriction within the chest cavity. Extensive rib fractures or significant lung lacerations also make recovery harder. And, the reality is that treatment can be prolonged and expensive, so owner resources and commitment, unfortunately, can become a factor too.
That's a practical point.
It is. But despite all these challenges, it's important to remember that many horses that do survive pneumothorax can return to a good quality of life. However, owners should be aware that athletic potential might be limited in some cases, especially if there is some residual lung damage or maybe adhesions form in the chest during healing.
That was a truly deep dive into equine pneumothorax. It's quite remarkable, really, how the delicate mechanics of breathing, something we take for granted, can be so dramatically disrupted by something as seemingly simple as air getting into the wrong place.
It really makes you think, doesn't it? How does understanding these intricate, sometimes hidden systems within a horse's body, these critical emergencies they can face, and the incredible advancements in veterinary science, how does that deepen your appreciation for these animals and the sheer dedication of the people who care for them?
That's a great question to ponder. We hope this deep dive has given you a clear, concise understanding of this critical condition, really providing those key takeaways so you feel well informed. Thank you for joining us on the deep dive. Until next time, keep exploring.